Trigger points in the serratus anterior muscle, as you can see by this illustration, can cause a strong referred sensation into the lateral part of the chest and ribs and cause a very strong referred pain into the mid-inferior scapular border. Another lighter sensation can also be felt down the medial arm into the pinky and the ring finger. This can be a particularly perplexing referred pain pattern for the patient, especially an athlete, because it can really stop them in their tracks. So let's get on to the advanced trigger point techniques for treating the trigger points in the serratus anterior muscle. For placement of the patient, as you can see, client or patient, I'm using a body support cushion, a two-piece system here. And I've separated the top and the bottom segments so that the inferior arm and shoulder can be very easily placed in the space, and we still get a good amount of support for the head and neck. We would normally, of course, have been fully draped here with the arm in a backward extended position, but for the sake of the video, I'm going to undrape here so you can see where we are. So what we'd like to do is, the therapist comes into a standing lunge. We've got the arm and shoulder stacked. I'm going to place my elbow into the lateral edge of the torso between the ribs, about at the level of the nipple line or the middle segment of the chest. I'm going to have the client keep their arm nice and relaxed. I'm going to press down with the broad part of my ulna. I'm not pressing with the tip of the olecranon at all. It can be very diggy. We're going to press down and in. As we do this, we want to bring the arm back into humeral extension. Give me a number of discomfort I'm causing you.
2.
2. We want to ask, any referred pain, any spreading out, any shadowing of discomfort anywhere?
No.
I may pull up and repeat in the same area. And we would do this for a repetition of 3 times. Then I might move up, superior to the next rib segment. Give me a number of discomfort here.
1.
1. And again, I'm using my back leg, I'm using my body to lean forward and press into my own arm. One of the biggest mistakes therapists make is to use the lat to pull down or press down, when in actuality, my lat and my teres are very relaxed and I'm leaning in, simply using the pressure through the bone. So again, treating and stretching then, after we've treated, we want to reach up and bring the arm all the way back and forward. Reach up and through, bring it all the way back. One more time, and all the way through. So we would have treated, again, we're going to superimpose the illustration here for you. Serratus anterior, you can see, think of the edges of a serrated knife, and there's going to be muscle bellies in between each one of the key ribs. So you want to make sure that you're fanning out and getting all the segments of the serratus anterior. So there's a little advanced treatment techniques for you on the treatment of the serratus anterior muscle as a contributor to thoracic, chest, and even down the medial arm pain. Brought to you by the Chicago Center for Myofascial Pain Relief and Advanced Trigger Point Seminars.